Welcome back, ladies and gentlemen. Now with our main topic, we're discussing today the inaugural session attended by President Abdel Fattah al-Sisi yesterday, the Conference of Health and Development and Population, and for the second edition, 2024, and the speech by President Abdel Fattah al-Sisi, and also the statements by the Health Minister, Dr. Khaled Abdel Ghaffar. The meeting, the session was attended by also the health ministers of Iraq, of Palestine, of Greece, of Lebanon, and it gathered a large number of officials. Well, to shed more light on this, we have the pleasure to have with us over the phone our dear guest, Dr. Mabrouk, plastic surgery professor at Shams University. Good morning.
Good morning, madam. How are you?
Good morning, doctor. First of all, I'm really delighted to have you over the phone, and we would like to know more about this conference, about the agenda, the attendees. How do you comment on this conference?
Well, I think the idea of this conference in particular is very, very important, as it checks the efforts of the government on the improvement of the health services that are presented to the population. Because as we know, that there are two pillars of advance of any society, which is education and health. You need a healthy population to perceive and to go through a successful career of education. And the population of Egypt is its main fortune, and therefore the good care of that will definitely improve the outcome.
Yes, so Dr. Mabrouk, also we'd like the President Abdel Fattah al-Sisi delivered statements during the conference, and he said that Egypt became free of hepatitis C, which is one of the most important achievements by the state of Egypt. Also for his part, Dr. Khaled Abdel Ghaffar, the health minister, also spoke about this point. If you would like to shed more light on this.
Definitely. Hepatitis C is one of the dreadful sequelae of health problems that Egypt has suffered in the past almost 30 years. And there was always fear that there is no light in the end of the tunnel, and that there will be always suffering and increase in the number of infected people, and we're going into a vicious circle of the patients infecting their relatives and their friends and their acquaintance simply through the transfer or whatever method. The idea of suddenly discovering a medicine, and this medicine to be a national project of the President and the Ministry of Health, and the prospect of complete treatment of our patients has definitely improved the outcome of the health, and has led to a marvelous result by declaring Egypt free of hepatitis C, which is a sequelae that destroys the livers of Egyptians and was a great hazard.
Of course, Dr. Amr, you mentioned earlier that the two pillars that are really important for the progress of any nation is health and education. So in the context of education, of course, you know that Egypt is always keen on applying the SDGs, the Sustainable Development Goals. So when it comes to education, how do you comment or how do you expect the outcomes of this conference to come regarding the investment in medical research? What is the importance of this, and what do you aim in this context?
Well, of course, the improvement of the health research and the medical research is a very important pillar in the advancement of the health services. And nowadays, not only the faculties of medicine, but all the medical faculties, including pharmacy and dentistry and science, and faculty of science and physical medicine and nursing, are competing together in fulfilling the dream of doing research and publishing this research work in international journals in order to acquire the accreditation and credibility of their careers. So it's becoming a must for any scientist in Egypt to work heavily and invest a lot of his time in medical research and in scientific research in general. And of course, if this is the motive for improvement of research, definitely the outcome will be beneficial, because we need a lot of research that can be applied directly in improving the health condition of the Egyptians.
Yes, Dr. Mabrouk, also during the conference, Egypt was certified as free of malaria. How did you see the importance of this?
The studies that they used to have back in the 90s and the 80s during our study in medical school was that malaria is a very endemic disease in Egypt, and there were some certain times every year that malaria has infested Egypt, and with a very bad outcome on the patients and the affected citizens. And the declaration that malaria has ceased to exist in Egypt is a great advance, because this means that the source of malaria, which is the mosquitoes that are responsible for spreading of malaria, which flourish in swamps and dirty water, has stopped existing, and therefore this is another indication of improvement of the civil service of the community to improve the outcome and to guarantee that malaria is not going to swarm Egypt again.
Yes, Dr. Amr, and also one of the themes of this conference is from prevention to prediction. So how do you comment on this? Because this theme is concerning the public health. So what is your comment on this theme?
This is very important. The prediction or the early diagnosis of any diseases or infection of human beings is a must. And therefore, the investment that has been done in the past few years in the pre-assessment of the conditions of patients and human beings in general and citizens in general to control the presence of chronic diseases such as hypertension or diabetes, and assessing the patients before complications develop. We know that we have improved, thank God, there has been improvement in the average age of Egyptians, reaching almost 74 in females and 73 in males. And this is a very good age in comparison to the international figures. But what is important is not the years, but the quality of life. Investment in the pre-disease conditions, such as the early discovery of diabetes, or the early discovery of hypertension, or the early discovery of cancer breast, can lead to complete cure of this disease, or at least limit the effect of these side effects. So investment in pre-diagnostic, or in the investment in the early diagnosis, it's very important, and this is a very important policy that the Ministry of Health is doing nowadays in the past few years.
Yes, Dr. Mabrouk, still on the same point of the early detection or discovery of diseases in Egypt. Actually, Egypt have launched several initiatives in the past few years, launched by President Abdel Fattah al-Sisi for the early detection of diseases here in Egypt, and especially for women and for children also in the stage of the school age, also especially for women and for the breast cancer. Yesterday, President Abdel Fattah al-Sisi also stressed on the importance of the waiting lists for the patients. So give us an idea about this, the early detection and stopping or putting an end for the waiting lists.
The waiting list has been always a problem because it was a disorganized array. Patients would go and visit hospitals and ask for doing surgeries, especially if these surgeries are not an emergency surgeries, and therefore they find themselves lost in a waiting list that is endless. The concentration of the government and the work of the President on this perspective, and especially the needy patients, and gradually recording and registering all the number of patients that are needing any surgical interference or any investigation to be done, and putting them on a computerized record and allocating them to the proper hospitals where they would receive this management, and this becomes a central and into a satellite hospitals all over Egypt, definitely has helped in improving the waiting list and reducing the number of patients in this waiting list, which definitely has a great outcome on the health of the Egyptians.
Of course. Actually, my colleague Amal raised a very important point regarding the waiting lists, and one of the government's approaches that are taken to solve this problem is the health insurance system and the reformation of this system. So, Dr. Amr, how do you comment, or what is your opinion regarding the state's universal health insurance system?
We have to draw your attention that Egypt has, during the pharaonic period, has had the oldest national health system, where the physicians were responsible for treating of the patients for free and reporting that to the highest authorities, which were the personal physician in charge of the pharaoh. So when we're talking about the national health system, Egypt has a country that has done this thousands of years before, definitely is going to be a pioneer in this, covering early smaller governorates like Bursaid and Ismailia, and aiming for an ambitious trial to reach all the populations of Egypt and all the governorates, especially Cairo and Giza, which are enriched with a huge population. Definitely is a very important aim. Presenting the service under the umbrella of the national health system will definitely improve the outcome, and reaching the important pillar of keeping the Egyptians healthy and mighty so that they can work and improve our economy.
Yes, Dr. Mabrouk, also during his word before the conference yesterday, the Minister of Health and Population, Dr. Khaled Abdel Ghaffar, spoke and mentioned very important points by numbers and percentages, and he said that in various fields there were mega projects that were established and with a budget of 177 billion Egyptian pounds spent on the health sector over the past years, and he also said that about 1 trillion pounds have been spent on developing the education. Concerning the health, which is of course a very important system, and it's high on the agenda and the program of President Abdel Fattah al-Sisi, the health minister said that there was a great leap and developmental projects in the field of health and medicine.
Yes, definitely, it's very important. The investment in health service is very important, and I have seen myself during my work in my work in the university and at Shams University that there is definitely an improvement in this service, providing this service for the needy, and it's any amount of billions of pounds that are spent are definitely rewarding, and it's a very wise decision to allocate a great amount of the income of the country to improve the health service to treat these patients. The investment is a long-term investment, but definitely it's very, very rewarding.
Of course, Dr. Amr, and I think it is also important to mention the role of this network, the networking process that's going to take place in this conference, and what outcomes could happen, because entrepreneurs, media personnel, and investors, and many more officials actually will attend this conference. So what are the outcomes of this great networking process?
It's very important to draw a policy that we are directing ourselves towards it. And this policy includes the proper planning, allocating the amount of money necessary for a certain project and going through this project until finishing it is really very important. Sometimes we might, during our practice and during our work, we find other projects or subjects that should be attached and should be attacked rapidly and giving more allocations. So the continuous conferencing and the continuous meetings, always, all this will help to correct and to direct the path towards the most important projects as we go. So the planning and then the management of this plan and control of this plan in different directions will definitely lead in the end to a greater outcome.
Yes, Dr. Mabrouk, also the Health Minister, Dr. Khaled Abdel Ghaffar, mentioned also the Decent Life Initiative, which is a presidential initiative launched by President Abdel Fattah al-Sisi, aiming to lift the burden on the citizens and raise the standards of living of more than 60 million Egyptians. Give us an idea about the importance of this point and the Decent Life Initiative importance in providing development projects in the field of health and education.
Definitely the important thing about decent planning is, or a decent life is, what are the pillars of a decent life? A proper housing, a proper education, a great work to be done, and of course a healthy individual who is going to do this work and to enjoy all these benefits. So in going into this different perspectives of this initiative, we see that we are going for housing and for education and for supplying the important basic needs and definitely the health control. It's very important to increase our efforts in the fields of improving education.
Yes.
The needs for education are very important. Knowing and increasing the amount of information that can reach the population, the trials of reaching through the internet to knowledge bank and knowledge libraries, making this information available for the important students to go on to continue their education, either in school or out of school. This is very important. The following of other experiences of other countries that have gone through this period of improvement of education should really be our guiding pillar or our guiding path in our direction towards improving education. And definitely we can take up a lot of experiments that has been done successfully in other countries, like what we have seen, for example, in India, in reaching how education was able to reach rural areas, how the incentives that are given to the students to attend the school by giving them, for example, a warm meal during the midday, or improvement of the incentives and giving chance for the students who excel to progress to more scholarships or more free management to get an access to education. We have to note that the IQ of human beings differ, but this does not mean that the people who are in the south or in the north are different than those on in the capital. So reaching out for the people who are well prepared for education and directing them towards the right path is very important. The counseling of students to tell them that this is the most important path if you want to join, will direct you towards a better future, is definitely important.
Yes,
the counseling is important.
Yes, I thank you very much. We thank you very much, Dr. Amr Mabrouk, the plastic surgery professor at Ain Shams University. Thank you very much for joining us over the phone. We really had the pleasure to have this phone with you. Reem?
Thank you, Dr. Amr, and actually, dear viewers, it is also it was very grateful insights from Dr. Amr that we have just listened. And now we move to the next feature about Sinai, who you all know is a very dear part to Egypt. And actually, all tourists, when they visit Egypt, they have to include it in their vacations to its great importance to Egypt. So now we will just watch the next feature, and we will be right back in the breakfast show.